Chair, I would like first to congratulate the organizers of this event because it shows the importance they place on safety and health at work, because safety and health means improvement of productivity and improvement of the product quality. And for small businesses, this is very important. And I would also like to thank the organizers for inviting me here today to transfer our experience in Cyprus from the development and application of the OiRA tool in Cyprus. As you heard already, Cyprus was the first member state that developed and applied this tool when it was prepared by the agency in the hairdressing sectors in Cyprus. I will start with some provisions of the legislation of the Framework Directive. A few words only on the OiRA tool. The role of the Competent Authority of Cyprus as we saw it regarding the OiRA project, how we selected the economic activity where we would apply the OiRA project, the OiRA tool, some facts and figures about Cyprus and the hairdresser sector, how we implemented the whole project, how we promoted the tool, the results, the work in progress, and the conclusions from the whole project, which will help us for the next steps. Now, the Framework Directive on Safety and Health at Work in Article 9 provides for the employer that the employer shall be in a possession of an assessment of the risks to safety and health at work, and B, decide on the protective measures to be taken. In the same article, in paragraph 2, provides that member states shall define, in the light of the nature of the activities and the size of the undertaking, the obligations to be met by the different categories of undertakings in respect of the drawing up of the documents provided for in paragraph 1A and B, that is the risk assessment which is obliged by the employer. So there are obligations regarding risk assessment both by the employer and of the competent authority. And this is actually the core issue of the whole directive. These obligations we realized very soon as we acceded the European Union, and we tried to enforce the new legislation. Our labor inspectors were faced with questions by the employers. How shall I prepare this new approach you ask us, this risk assessment, and why you don't give us an example, why you don't give us a method? I don't know. I didn't do anything because I don't know. And we were concerned with these questions because we wanted to help rather than to enforce the law. And what we found out was that we were not only in Europe facing this question. Actually, in a European survey which was carried out on behalf of the European Agency in 2009 among European enterprises in various member states, in all member states, it was found that 41% of the SMEs in the European Union lack expertise to assess the risks. And 38% stated that risk assessment is too expensive or too much time consuming. So we thought that the OiRA tool it was a chance for us to close this gap. As you heard, it is a neat tool that may be used through PCs and laptops and so on. It is designed specially for SMEs, and Cyprus is full of SMEs. Only big hotels and big companies like banks and insurance companies belong to bigger enterprises. And it is designed especially for SMEs and micro enterprises for various types of economic activity. As you heard already, within the EU Strategy on Safety and Health at Work 2007-2012, it was a call for the development of simple tools to facilitate the procedure of risk assessment. It is clear that this issue was all over Europe, an issue. It is a risk assessment software developed by the agency. You can find it in the agency's website, which is better to find it through that website rather than through the specific website, because if you try to find through the ECHA website, through the agency website, then you will see many information, much more information, and which I'm sure you will be interested in. It is interactive, easy to use, free, and can help employers to prepare risk assessment for their workplaces, for their specific workplaces. The tool, we found that it contributes to the increase of the number of enterprises which assess and manage occupational risks, and contributes also to the improvement of working conditions, thus helping for the reduction of occupational accidents and diseases. But be cautious. It is a tool, like any other tool, like any other e-tool. You should be cautious, you should apply it with caution, and you should know that if the employer breaches the law, there cannot be an excuse that it applied the OiRA tool. The tool should be critically utilized and explored. The tool provides a lot of measures for the employer to take, but it's upon the employer to select the right measures for his or her workplace. So within this framework, we thought that we could help because the OiRA tool was within our role. The role of the Department of Labour as a competent authority for OSH is to assist the SMEs and micros to meet their obligations in OSH legislation by developing a risk assessment culture, by building capacity and organizing occupational safety and health promotion activities, by providing adequate and suitable training, by providing information and guidance. On risk assessment, our role was to help employers and self-employed persons to implement the legal requirements on risk assessment, to provide an effective, less resource-demanding option on OSH, and to reach the employers self-employed with the lowest implementation effort for risk assessment. Specifically for the OiRA project, we believe that our role was to ensure that the social partners become aware in the development process from the beginning. It's something which was stressed previously by Lorenzo. To provide the social partners simple information, easily transferable to a broader group of users, and to provide the users with specific and relevant tools and guidance to enable them to take decisions. So the challenge was which sector shall we select? We have a lot of economic sectors, even in Cyprus, a small country, smaller than Slovenia anyway. We put down some criteria, and we thought that it should be better to be rather high than low risk sector, and a small sector, to be able to check it, to check the results, to communicate better, to have feedback better. It would be good if the leadership of the sector could be active in social dialogue and keen to improve the occupational safety and health levels at the workplace. We had some data in front of us. Since 2006, on a national general survey on the physical and mental diseases of the working force in Cyprus, we had some surprising results for us on the hairdressing sector, which we didn't know up to that time. Within that questionnaire survey, we found out that 78% stated that they suffer general fatigue of the hairdressers. and 67% of the hairdressers stated that they suffered pain on the bones. These results prompted us to proceed to a specific questionnaire survey for hairdressers. And we found out that 86.5% of those responded stated that they suffered pain on bones, joints, and muscles. 60.8% suffer from back pain, 44% from neck and shoulder pain, 50% feet and leg pain, 40% hands and arms pain, and 40.5% pain in the joints. So we saw that we had really a sector with a high risk for its employers and employees and self-employed. In Cyprus, we have about 2,500 hairdresser salons and 3,400 employees and self-employed. There are some, let's say, big salons with 15, 20 employees, others small ones with 3 to 4, and many of them with one or no employee, but only the self-employed person in the salon. They are all organized in an association. They have their own school and their own inspectors. They have home inspectors, internal inspectors that inspect the salons. And there is a law that covers the profession of the hairdressers in Cyprus. Nobody can be a hairdresser unless he or she is registered with the association and meets their criteria and the provisions of their legislation. The social dialogue in Cyprus is widely practiced, so we don't have any, as an authority, any problem with discussing with any employers or unions on this aspect. And our health and safety at work law covers both employed, self-employed, and third persons at work. So we didn't have any problem with applying the law on any kind of hairdresser salon in Cyprus. Within this data on hand, the European Campaign on Healthy Workplace Initiative for new member states, which was organized by the European Agency, we decided to focus it on occupational safety and health for hairdressers in Cyprus. And within this campaign, we prepared in Greek, of course, training material on OiRA for hairdressers, as we found out that within a collaboration project, there was already a manual for hairdressers. Also, in 2008, with the communication and the collaboration we had with the Hairdressers Association, the Department of Labour Inspection managed to join the technical committee for the development of the Cyprus vocational qualification for hairdressers, which for the first time included a module on safety and health issues. Another fact which already I mentioned is that the Hairdressers Association was a collaborative association. It is a very active association. It has interest in safety and health because it knows and acknowledges the risks the hairdressers face every day. And they requested the help of the Department of Labour Inspection to improve occupational safety and health in hairdresser salons. That's what we actually wanted to hear. So with all this in mind and in hand, we started thinking of applying the OiRA tool on the hairdressers sector. We called upon the association first to discuss with them methods for the improvement of the health and safety levels in salons. And we put some targets down: the improvement of the working conditions in the salons, the systematic reduction of risks to workers and customers, provision of assistance for the implementation of legislation, whatever they needed, we could help them. And we could try to reduce for them the administrative burden. We also decided that we had to prepare the hairdressers to be capable to assess occupational risks, thus improving the performance of their enterprise, to become aware of the risks they are exposed to learn how to prevent future health problems, and to apply the OiRA tool to facilitate risk assessment. In a second meeting, after we were prepared well about the OiRA tool, and we had discussions also and assistance from the agency, we explained to them and analyzed to them in detail what was the tool about, what were the capabilities of the tool, and we decided what modules and sub-modules the tool would include, and all the steps which would follow. So after we decided this, we started developing the tool. Actually, we assigned one inspector with good knowledge on IT, who had, let's say, a very good knowledge of the legislation and practical experience on the field, who, with the help of experts from the agency, I would say that the agency also sent personnel from Bilbao to Cyprus to test the tool, because we wanted the tool to ascertain that it is easy to use, is simple, serves the needs of the hairdressers, uses a language which is understandable, and that the preparation of a risk assessment based on the tool does not take too much time. And it took us 8 weeks to develop the tool. After the tool was ready, we organized, with the help of the association, of course, of the hairdressers, local seminars on every district in Cyprus, whereby about 500 members of their association participated and actually were trained on the tool. We also provided special training to the inspectors of the association, so that they could help the hairdressers to use the tool. We also tried to help with other ways the promotion of the tool by publicizing relevant articles in the Hairdressers Association magazine, so that we could keep the interest of the hairdressers. And also we organized a help desk in our office, which could give guidance and advice to those who wanted to use the tool and they had any problems, questions, and so on and so forth. What were the results? There was a positive reception and feedback of the tool by all players. We talked with many hairdressers, we visited many salons, and we found out that there was a good reception of the tool. I personally was continuously asking my barber if he used the tool, and I saw him. myself that he applied the tool. Since September 2011, the tool is online, and many employers and self-employed persons in the sector use it for the preparation of the risk assessment of their well pieces. Based on our experience now, we are already having used a tool on working offices, and on this we had extensive discussions with the public sector employees union. And we, under pilot testing, there are other two tools, one on butcheries and one on catering. As you heard, it's over 50 OiRA tools now in 11 countries. Now I heard Lorenzo, by the end of the year it will be 15 the countries that will use the OiRA tools. 25 are under development, and I hear happily that 7 tools are being prepared in Slovenia. So to conclude, before you start applying the tool to an economic sector, find out the role of the competent authority regarding the tool, study the statistics and or surveys you have in front of you in order to help you select the sector of economic activity. Have consultations from the very beginning with the social partners. Request the assistance of the agency of the European Union, OSHA, on this. Organize seminars for the training of employers and employees, and pilot test the tool before you start promoting it. Thank you very much.
Thank you.